Hi, my name is Mackenzie Gallagher. I am a nurse and MSN student at Pacific Lutheran University, and I did my master's preceptorship at St. Joseph Medical Center, Neonatal Intensive Care Unit. The title of my quality improvement project is the implementation of a swaddle bathing policy in the Neonatal Intensive Care Unit. So the idea for this project was started in the skincare committee within the NICU, and they currently had a bathing room that was not being used by staff, and there also was no policy regarding bathing in their unit. So I decided to take the lead on this project and implement a policy for bathing in the NICU. And we were hoping to also update the bathing room in their unit. So to begin my project, I did a literature review on the benefits of swaddle bathing and also research on other units that had implemented a swaddle bathing policy within the hospital. And I found that studies that compared swaddle bathing to other conventional bathing methods, such as sponge bathing, found that swaddle bathing is the preferred method because it is really effective for reducing the amount of stress that NICU babies are experiencing when being cared for in the NICU. And it also is the best at improving thermoregulation and reducing heat loss, which is very important for babies that are cared for in a NICU. So to start this policy, I looked at data from January of 2019 to 2020 to see what the current bathing practices were within the nurses in the NICU. So the first graph is the lower right graph, and that is showing number of baths given per month during that time frame. The data here is varied, but you can see that in summer months, such as June and July, the number of baths given are much more than in the winter months, and that is directly related to census during that time. So in the summer, the census is higher in the NICU, and in the winter time, it is lower. The graph on the left-hand side is showing the proportion of infants that received at least one bath prior to discharge, and we found that during that time frame from January 2019 to February of 2020, only 41% of infants received at least one bath prior to discharge. So looking at that data, we decided to focus on that 41% number, and we really are hoping to increase that number to 80% after the implementation of this swaddle bathing policy. So in terms of interventions for this project, St. Joseph Medical Center utilizes the Plan, Do, Study, Act model, which is the model used by the Institute for Healthcare Improvement. So you can see here, we planned, we did, we studied, and we acted upon the interventions that we planned for this project. So the policy was drafted based on the current research recommendations. The policy was approved by the Standards Committee at St. Joseph Medical Center. I then educated the NICU staff at the staff meetings about the new policy, and we updated the bathing room within the NICU so that it was a really good space for nurses to provide swaddle baths to the babies. In terms of barriers for this project, unfortunately with the coronavirus pandemic, I was unable to collect post-intervention data, but we're hoping that this will continue to be collected in the future by my preceptor, who is the NICU director. So this project is still in process currently. In terms of nursing implications, we discovered that swaddle bathing is really a sustainable process that can be implemented in any NICU in any hospital. I also learned that it's really important for nurses in any stage, at any level, in any setting to be involved in quality improvement and really have an impact on change within their unit. We also discovered that swaddle bathing should really become a standardized policy and practice within any NICU and be incorporated into their nursing care. In terms of future research, I think it would be important to look at the relationship between bathing and occurrence of skin infections. And one could also look at studying interventions that would promote family involvement in swaddle bathing and really promote the family integrated care in the NICU. So that concludes the overview of my quality improvement project. I'd like to thank my preceptor, Kim Danaka, who is the NICU director, for helping me with this project. Also would like to thank Kim Hoover, who was a nurse in the NICU that was interested in this project and assisted me with educating the staff, and also the Perinatal Quality Improvement Committee at the St. Joe's NICU for their support with this quality improvement project. Thank you for listening.